Morning, everyone. I'd like to call this meeting to order for the Corporation Township of Whistler, May 27th, 2026. Start with roll call. Councillor Hurst.
Present.
Councillor Goida.
Present.
Councillor Spoulos.
Present.
Councillor Bailey.
Present.
Excellent. This will begin our moment of reflection. All right, that concludes our moment of reflection. Ms. Brotherson, you have confirmation of the agenda, please.
That council approves the May 27th, 2026 agenda as circulated, and that council approves the addition to the agenda as follows. Consent item 6.1.6, questions received from council seeking additional information, and the corresponding responses provided by staff regarding the May 27th, 2026 council agenda.
So can we move for that, please? Councillor Hurst, Councillor Spoulos, any questions or comments? Favor? It's carried. In disclosure of Canary interest today. Item 1. Item 14 or 2. 14.2.1 and 14.2.3 is the minutes of the closed session. And generally, trigger Canary interest is I own property adjacent to the development. Right. I believe we're going to invite our first delegation down. Is that correct? Okay. You two folks.
We have people.
Oh, sorry, wrong person. Come on down.
Okay.
Grab a seat. Yeah. Welcome.
Thank you.
Floor is yours.
Amazing. My name is Annie Perkins. I'm the Director of Transformation with the Guelph Wellington Ontario Health Team. And I was invited to come and speak to you about a couple of issues, and I will forewarn you that I may have some of the questions or some of the answers to your questions. But what I'm going to share may just be a primer and elicit more questions. Specifically, I understand your questions were about long-term care, access and capacity, and what is being done in the community to keep seniors safe in their homes. And so the work that I do as Director of Transformation with the Guelph Wellington Ontario Health Team has the ability to influence some, but not all of those issues. So I will share what I can. And like I said, I'm happy to take away any additional questions, come back and speak about those, and or invite other members of the system that have better answers to your questions. So first of all, I wanted to share a little bit about the Ontario long-term care ecosystem, share what the Guelph Wellington Ontario Health Team is and isn't, and then share with you some of our key activities and priorities that we are undertaking to help keep seniors safe in their homes in Guelph Wellington and including Whistler. Next slide. The long-term care landscape in Ontario is complex. It involves the Ministry of Health, a relatively newly created Ministry of Long-Term Care, Ontario Health, and Ontario Health at Home. And each of those organizations has a different role in supporting access and capacity to long-term care. So I'll go through each of those. Next slide, please. First of all, the Ministry of Health has a broad stewardship of the health system, including funding and agency oversight. So this includes high-level accountability for Ontario Health and Ontario Health at Home, which I'm going to speak about next. Next slide. The Ministry of Long-Term Care, as I said, is relatively newly created. It was actually created in 2019, so just ahead of the pandemic. And it was intended to create laser focus on the long-term care sector as the sector that supports the health of some of our most vulnerable community members. The Fixing Long-Term Care Act came after the creation of the Ministry of Long-Term Care, largely in response to some of the experiences and lessons learned coming out of the pandemic. The Ministry of Long-Term Care also ensures compliance by doing inspections and enforcing different parts of the legislation. And finally, the Ministry of Long-Term Care makes decisions about funding for new long-term care homes across the province, of which there are 58,000 currently lined up. Next slide. So one layer sort of underneath those ministries is Ontario Health. And as I mentioned, Ontario Health acts as the provincial agency that oversees and has the role of connecting different parts of the health system. It also supports accountability and performance of different health service providers within the system. And it generally provides oversight to an agency called Ontario Health at Home, which used to be called CCAC and then Home and Community Care. It's now referred to as Ontario Health at Home. And so Ontario Health has direct oversight of Ontario Health at Home, which is on the next slide. So Ontario Health at Home is the agency, as I said, that delivers home care, but also performs the functions in our health system that are related to accessing long-term care. So helping to assess eligibility for long-term care, supporting application to long-term care homes, and then supporting individuals to access those homes and providing home care while they are waiting in the community. Next slide. So here's a summary of those four organizations that I just spoke about: Ministry of Health, Ministry of Long-Term Care, Ontario Health at Home, and I've added in the OHT so that you can understand where the organization that I work with and for fits into all of this. So the Ontario Health team is the local group of partners that come together to support coordinated and integrated health and social services in our community. I'll talk about that next. Next slide. Perfect. So Ontario Health teams were created when the LHINs were dissolved. For those of you who may have been familiar with the local health integration networks, there was 14 LHINs. They were combined into Ontario Health. So they became one provincial organization along with other agencies, including Health Quality Ontario. And at the same time, 58 Ontario Health teams were formed across the province, with the intention that there was value in having local partners come together to identify local problems and local solutions to those problems. So at the time, and continuing to this day, the Ontario government is investing in Ontario Health teams to build connected healthcare systems that are centered around the patients, families, and caregivers in each of the 58 communities across the province. They are intended to be a new way of organizing health and social care so that we can be more responsive to the needs of the community. And under Ontario Health teams, healthcare providers, as well as social care providers, come together to work as one team. Next slide. Here's a list of the core partners, the Guelph Wellington Ontario Health team. We do have another large set of partners who are community partners, but these are the groups that have invested leadership, governance, and intense working group support for the Ontario Health team. Just want to be really clear that the Ontario Health team is not a separate or distinct entity or agency. We are not incorporated. It is a group of incorporated health and service partners that come together to, as I said, identify local problems and local solutions. In line with the engineering principle that systems are perfectly designed to get the results that they get, each of these organizations structurally and sort of functionally retains their board, retains their accountability agreement with their funder, And so by design, the organizations that exist in our community aren't sort of set up to be deeply integrated. And so the idea that patients or people in our community would then experience sort of seamless transactions or transitions as they move between services at these organizations. It's not designed or set up that way. So that's the work that the Ontario Health Team does, is bringing these partners together to identify ways that despite how the system is structured, we can be as seamless as possible as patients transition across the system. Next slide. So our shared purpose, when all of those partners come together and identify what is our work to do and our commitment as separate, distinct organizations, but coming together as partners, is to advance integrated care through partnership and collaboration to improve the health of the population of Rock Wellington. Next slide. Here are our strategic priorities. I'm actually going to get you to flip to the next slide because I want to share that these strategic priorities, again, we are not an incorporated entity, but rather a group of partners that have come together and identified these 4 strategic priorities related to thriving and supported workforce, people-centered health and equity, sustainable system and advocacy, and transformative partnerships. What I've done is I've listed the organizations who share that strategic priority in their organizational strategic plan. So part of the work that we do at the Ontario Health Team is to identify strategically and operationally where there are opportunities for organizations who are otherwise structured and mandated to be separate and individual organizations to come together to have collective impact towards improving the health of our community. Next slide. Just a bit of some sense making of sort of what we are attempting to do as a Guelph Wellington Ontario Health Team is to take the provincial priorities, which are related to primary care access, attachment, and enablement, integrated clinical priorities, and OHT capacity building. So those are the priorities that the province has given OHTs. So we take those, which are the bottom down, we identify the bottom up priorities, as I've already shared, the OHT strategic priorities, and sense make and prioritize how we can best advance all of those to improve the health of the population. Next slide. And so the last slide I will leave you and hopefully get to your STEM question, which was what's being done in our community to keep patients safe at home. Some of our key activities, so these aren't the only ones for sure, but some of the ones that I wanted to share with you are related to some work that we've been doing over the past 4 years to transform how home and primary care are provided. As I mentioned, primary care teams are funded separately from home care, and often that results in patients experiencing just that their primary care team is over here and their home care team is separate and distinct from their primary care team. We've had the opportunity, we're one of 7 OHTs in the province that has had the opportunity to deeply integrate by legislative changes and other system barriers to bring together primary and home care providers onto a single team so that patients are able to experience a single team of home and primary care providers. We are also, hopefully you saw the news, we were successful in a proposal that we submitted last November. We were successful in attaining 72% of our $6 million ask and have received $4.4 million to attach 12,000 patients in Guelph Wellington to primary care. So this is in line with the provincial priority to have all Ontarians attached to primary care by 2029. We made a bold proclamation when we submitted our proposal in the fall to say we want to be the first Ontario Health Team to achieve full attachment. And I'm very confident that we will do that well ahead of the 2029 target. And so I would ask for your help in promoting to the residents of Puslinch that nobody in Guelph Wellington should be without a primary care provider. We have capacity. Our challenge now is actually finding those who are, according to the data, without a primary care provider. So we have lots of information about how to get attached. Certainly Healthcare Connect, if you Google that, that is the provincial registry for those who are interested in becoming attached to primary care. But we have developed posters about why it's important to have a primary care provider. Often, we have about, again, according to the data, about 17,000 unattached patients across Guelph Wellington. And often the last 10% of a population are the most difficult to find and support them to become attached to primary care. So anything you can do to help us to find those individuals. But the message is we have capacity and we want to support everyone to get attached to a primary care provider. Lastly, we are focusing, before I go on to the last one, related to primary care, we are focusing, once people get attached to primary care, supporting them to prevent and then manage any chronic diseases that they may have. So certainly doing a lot of work to ensure that we are supporting cancer screening where it's available. The age for colon cancer screening just reduced to the age of 45 from 50. So wanting to find that cohort of patients and support them to have that screening, mammograms and cervical cancer screening are also top priorities for us, as are chronic diseases, COPD or chronic obstructive pulmonary disease, congestive heart failure, diabetes, and frailty and falls. So we are developing clinical pathways and supporting through our primary care providers to support all patients to prevent getting those diseases, but if they do, to manage them as well as possible so that they can stay safely in the community, out of hospital and out of long-term care. Finally, a big piece of work is related to supporting those who are at risk of or who are experiencing homelessness, including from a senior's perspective. We saw in the last couple of years a significant increase in the number of seniors that were accessing the shelter system. And so some of our partners, CMHA and Stepping Stone, have recently opened a transitional shelter for seniors specifically, so that seniors who, as I said, would otherwise be accessing the shelter system are able to be in a comfortable home-like setting while they are supported to find more permanent housing. That concludes my presentation. I'm happy to take any questions, including questions that you may have had prior to the presentation that I did not answer. As I said, I'm happy to take them away and give you the answers that you're looking for.
Perfect. Thank you very much. Councilor Hurst.
Yeah, thank you. I mean, those are really good. I can, to a degree, appreciate the kind of the 5-year journey you've been from 2019 to today and how ebbs and flows of coordination go. I had 2 questions. I think the first one you sort of answered, I think, just what can a township do within the municipality to help your efforts or expand your efforts? And to me, what it sounded like was just communication and helping residents connect the dots to healthcare providers, whether that through whatever stage they are in their needs.
Yeah.
So I think I heard that one.
Yeah.
I'm curious if you can speak to just within Wellington County and then also Guelph, different communities have different needs, relative closeness to hospitals and everything. Can you maybe just speak to some of your learned experiences or lived experiences within the team of serving residents in more areas or villages and hamlets versus larger urban centers?
Guelph Wellington is unique in some ways in that we serve both the city and the townships that surround us. So Puslinch being relatively close to the city of Guelph compared to St. Mount Forest. But what's unique about Guelph Wellington and what those of us who live here may not recognize is that we have some of the most organized primary care in the province. So 90 to 95% of our primary care physicians work as part of team-based care models. If you go to Kitchener, it's the opposite. Between 90 and 95% of their doctors work as solo independent providers. So what that enables us to do, yes, access to hospitals is important, but what's more important is having access to care in the community. So we've really built our sacred vision, we call it, which is having everybody attached to primary care and supported in the community by an interdisciplinary team. And that works in all rural and urban settings. So that really is how we support and manage health, regardless of sort of urban and rural, recognizing then that if you're an urban team versus a rural team, there are different challenges. But what's been really great about coming together as partners through the Ontario Health Team is the opportunity to recognize that and to share resources and to really collaborate. So one of the things that I think positioned us very well to be as successful as we were in attaining $4.4 million for primary care attachment is that the existing 6 primary care teams in Guelph Wellington submitted a single proposal as opposed to them submitting 6 proposals and competing against each other. So our plan was a population plan that supported attachment for the whole population of Guelph Wellington as opposed to individual teams. Other jurisdictions that have less organized primary care would not have been able to do that.
Thanks. That's helpful. Maybe just my last question really quickly. And there was this slide, and we don't need to go back to it here, but you had all the various partners that you're working with. And it was very exhaustive, and it went through quick, but I didn't see any Puslinch Township points of reference or partners on that. And I could have just skimmed it, but are there any gaps that we have here that we can collectively help nudge towards?
Yeah, as I said, there's a long list of community partners. So the organizations that were listed on that slide are the ones that send a governor and an executive to a monthly integrated care council meeting and send members to working group meetings. But really the opportunity for Ontario Health Teams is to better connect health and social services so that not only are health organizations not planning and delivering care in isolation, but that health and social services are not doing it separately. So I would invite the Township of Puslinch to join as a community partner. That is one great way for you to receive information. There's no commitment in terms of time or commitment of capacity or resources, but what it really does is signal an intention and an interest in, as you've suggested, amplifying the messages and communication so that the priorities of the township can be known too and be part of the work that the OHT is doing and vice versa.
Thank you. I'm good.
Good. Councilor Goode?
Yeah, thanks for the presentation. Thanks for coming today. It's
It's not far, just the downstream.
okay. I just had a question about when we talk about sort of care at home and aging at home, and what that looks like. And I unfortunately have had to, in the past little while, have a lot of experience with Ontario Health at Home. And one of the things that we found to be a challenge specifically in Puslinch, but I imagine it's the same thing in other rural communities, is that sometimes having consistent care or because we are in a rural area, getting PSWs to come to us is sometimes a challenge because they don't all drive and we don't have like, city buses and things like that. And so it sometimes makes it difficult to rely on that care at home when you don't know if they're coming and when they're coming. And I'm just wondering if there's anything that we can be doing or your organization can be doing to sort of advocate to, I don't know, to focus some extra attention on that unique challenge of getting PSWs to these rural houses when they maybe don't have access to the same kind of transportation.
Yep, so I mentioned the top of the key activities that we are undertaking in the 4-year journey that we've been on as invited by Ontario Health and the Ministry of Health. So I mentioned our sacred vision, which was to have everybody attached to primary care and interdisciplinary primary care that included home care. And so part of that model that we've been able to advance as a home care modernization leading practice OHT, one of 7 in the province, is to address that exact problem, which is to say, not only is your home care team separate from your primary care team, but often the providers that are going into the home, especially for patients who have complex needs and have more providers going in, but it's often inconsistent in terms of the providers that are going. So the model that we've been able to trial is a model where I'm going to use my mother as as an example, because as I said, we, our Councillor Sepulis's neighbor, in Puslinch on Side 20, my mother lives with us. I provide care to her. By great fortune, her primary care provider is participating in the leading practice. And so the model that she's experiencing is different than the model that we would have experienced. And that model is such that her primary care provider has a dedicated care coordinator from Ontario Health at Home, but it's one care coordinator. So that care coordinator coordinates home care for all of the patients that are rostered to my mom's family physician, including her. We've then been able to procure a single in-home service provider. So in the traditional model, in-home service providers have market share and sort of they're assigned based on sort of whoever can fulfill pieces or parts of the care plan. But what we've done in our model is we've said for all of the patients at Coordinator 6 in Guelph, they're going to have a single care coordinator and they're going to have a single team of in-home service providers who are going to deliver all of the care to the patients that are rostered there. My mom's needs are not as complicated as some, but she does get support for bathing twice a week. And she has had the same PSW come every Monday and every Friday for over a year and a half. So it's that problem or that experience that we are through our model addressing. And our work now, we have the VP of Ontario Health at Home Corporate coming on July 8th because we need him to see and experience how this model benefits rural communities especially, but how it benefits patients generally and having a consistent and integrated home and primary care system.
Really good to hear. Great, thank you.
And that model not only is in place in Puslinch, but Mount Forest and Minto Mapleton, other communities north townships as well.
Thank you.
Councillor Spills?
Just a couple of questions. One for staff. Staff, is it possible that we set up something on our website for our community to be aware of this team and the work they do and how they can reach out to the appropriate contacts?
So through the chair, we can work together to see how that comes up on our website for sure.
Okay. A question for you with respect to the partners you had on your list. Councillor Hurston noted there wasn't anybody in Puslinch. We do have a Morrison Park nursing home. How does it work? Do you reach out to people like that or do they come forward to you?
I worked quite closely with Morrison Park during the pandemic. Part of our response was to ensure that they had PPE and had staff. We did some staff deployment to or partner organizations and even non-partner organizations who were having staffing issues. I haven't been in touch with them for a while, but I can certainly reach out again. We do have 2 long-term care homes on as core partners, the Elliott and St. Joe's, St. Joe Guelph, and they have a long-term care network. Are at the core table and then take that information back to other long-term care partners involved, but I can absolutely reach out and check in with our Morrison Park colleagues.
Great. Thank you very much for coming.
Mr. Bailey?
Yeah, thank you for coming. It's a big world that's, I think, unknown to a lot until you're in a situation where there's the need, and then you realize, where some of the gaps are and where it'd be good to have the conversations and figure out how all this is working. So thanks for all the work you're doing, because it sounds like you're pretty frontline with some new models and advocacy and stuff like that. The one I wanted to touch on was one question was about advocacy for long-term care, and maybe you can just help me understand how that need gets recognized. So, and I don't know if our local, long-term care facility has a long wait list. If it does, who is doing what about it?
Yeah, and so that's the question. Like the long-term care sort of capacity planning and waitlist management pieces are not sort of operationally a space where the OHT is necessarily in. From a capacity planning perspective, that that does sit with the Ministry of Long-Term Care. And so I would invite someone from that level of government to speak to how that is done. Shortly after the pandemic, we lost a long-term care home in Guelph. So we lost, I think it was between 50 and 70 beds. We do have St. Joe's Health Center Guelph in the active capital and planning to add more beds to their home, but that won't be for a number of years. I think the last I heard is they were aiming for 2029. So capacity planning sits with the Ministry of Long-Term Care. In terms of waitlist management, that sits with Ontario Health at Home. And I could absolutely invite one of my colleagues from Ontario Health at Home to come. When it is rare, when someone goes on the long-term care home waitlist, they have to identify 5 homes that they would be willing to go to. And 2 or 3 of those have to be a short waitlist home. So there is a whole very standardized process. I can't speak to what the current waitlist at Morriston Park is, but certainly I would be happy to invite one of my Ontario Health at Home colleagues to speak in more detail to that.
And so maybe help me understand, are there 5 in the area? Where would someone local in Puslinch?
So
Does it have to be within a certain
it has to be all of,
distance,
all
or
of, at this
anywhere?
point, I believe it's Waterloo Wellington, or maybe it's in the, I think it's Waterloo Wellington.
Okay.
And it's different if you are waiting for a long-term care home in the hospital versus if you are waiting in the community. It's very rare, and it should be by exception, that someone waits in the hospital for a long-term care home bed. However, if that happens, then the choice is different. I think you have to pick a short wait list home if you're waiting for the hospital. But in terms of, so if my mother needed long-term care placement from the community, she would need to pick 5 homes from all of at least Waterloo Wellington. I do believe you can put your name on a waiting list for a home outside of Waterloo Wellington, but the exact rules of engagement around that, I would leave for my Ontario colleagues to speak to.
Okay. A lot of questions asked already that was on here. You mentioned the goal of having all residents being attached to a primary care person, and you said the last 10% are sort of the most challenging. What are the barriers to getting that last group?
So sometimes it is newcomers to the country who maybe aren't familiar with what benefits OHIP provides them. If they come from a country where having a primary care provider wasn't funded, they may have the belief that that is something that they have to pay for. So that's typically one barrier. The other is if you've never had a primary care provider and you're relatively healthy and you've had your needs met through the emergency department or a walk-in clinic without having the benefit of having a consistent healthcare provider sort of follow your journey, then and you're relatively young, you might not sort of recognize the value in having preventative work and screening, and then having a provider who knows you, your family, and your history should health conditions arise. And then the third cohort of people who typically don't have and maybe don't watch a primary care provider is those who have had issues with the health system and don't trust that having a primary care provider is going to be safe or beneficial for them.
Some experience. You mentioned age. I was just assuming the senior population, but so some of that 10% could be the younger age group. Okay. And then I guess just touching back to the list of partners that, we didn't see a lot of Puslinch on there. You mentioned having a seat at sort of the table for conversation, the commitment and whatnot, but is there outreach? So from your perspective, do you connect with all the different potential
certainly make
care
an effort to.
partners?
There's a lot of them.
Yeah, but in Puslinch, there's
so
not a lot.
What I will tell you is that Mango Tree.
Yeah.
So we do sort of one of the tables in the OHT structure is a primary care network where we bring together primary care providers and the primary care organizations that they are a part of. So Mango Tree is a member of the primary care network. Yeah. But certainly our outreach is ongoing. And as a resident of Puslinch, it's
excellent. Thanks a lot for coming today.
Great, thank you.
Thanks.
Thanks for coming today. How do you know if people are attached to a primary care physician? Do you have literally their names and you have a list and you're kind of scratching them off?
So what we do have is data from the ministry telling us there are approximately 17,000 patients, not named, just a number. Generally, they can be sorted by postal code, so we can be given a map to say they live here. Another way to know who needs to be attached is through Healthcare Connect. So certainly there's provincial communication campaigns inviting anyone who doesn't have a primary care provider to register with Healthcare Connect, and then sort of we are actively working to get those patients attached. But otherwise, we are working with our health service providers. So the emergency department, for example, if a physician encounters a patient at the emergency department who doesn't have a primary care provider, we want them to be encouraged to register with Healthcare Connect, and we've provided the departments with that information. We've also set up an onboarding program such that if someone is unlikely, either because of language or trust or experience with the health system, they're unlikely to register with Healthcare Connect. We've invited, whether it's an emerge physician or a worker in the community or a physician in the hospital, to refer the individual to the onboarding program so that we can have a little bit more hands-on support for that individual, both to manage any health conditions that they might be dealing with and maybe took them to the emergency department.
Yeah,
but also
the reason why I asked is because the nature of our community, there's people that have primary care physicians in other municipalities, even regional municipalities. So it sounds as though there's at least a documentation for those people that they won't be on that list. They will be captured, even though they're receiving it. It was the Carlisle Medical Center that is progressively moving further away from Puslinch, but it was likely close. It was closer than going to some primary care as well. So I know that Puslinch residents were utilizing that, even if it's in the region of Hamilton. So that's good that they're on a list and you're not chasing, but after people that have primary care because they're captured. So that brings me comfort, because there could be people who use primary care in Cambridge and that'd be regional, whatever. But anyway, so that's excellent. I want to ask about the at-home care, and I don't know enough about it, but what it sounds as though there is an opportunity for support. But early in my tenure as mayor, I had inquired about grant programs to assist aging in place, I would call it. And I'd give examples as maybe doorknobs from round ones to the flats to open doors easier, or a ramp. And is there a place for municipalities to advocate for creation of a grant program that whatever ministry, hopefully that's a ministry, but it'll be a division. Don't get caught up on my terminology, but where they create the program that can be administered by the local tiers that we would receive applications. Has that ever been pursued?
Not to my knowledge, but leave it with me. I'll inquire to see if there is something. Certainly, we rely heavily on our community paramedics as key partners who are in the home and would identify that there need to be, that there are risk factors in terms of the individual's ability to stay safely at home, and so they would identify it for us. But often the resources to make the change is something that is sort of in the space in between anybody's mandate, right? So to your point, could we identify some resources and create a program to actually do some of those modifications? So between community paramedicine and our home care colleagues would typically be where those, so home care have, or health at home, they have occupational therapists who would usually be the ones who would make some of those adaptations.
Because the CEO created a program for additional residential units through a grant program that was created by the Wellington County. And in my mind, it would mirror something along those lines. We would be, it wouldn't be our money per se. It's all our money, it's all taxpayers, but you could receive a grant funding, and then through obviously we'd have to ensure that they're safe to be at home through the paramedic program, or whatever it may be. There's a lot of moving pieces here. But my other note was, has there been any studies on the cost benefit of aging that place in home versus the other options, because, and this isn't a knock, but the Wellington Terrace, last time I heard a report on it, it's, each bed is subsidized by the municipality at $50,000 per year. And if we're able to take that 50,000, not take it away, but equivalent 50,000 and support 4 people that age at home, that's appropriate. That's a win in my mind. So that's just kind of down the same rabbit hole.
Yeah, so I'll follow up on the grant opportunity and studies related to the cost efficiency of keeping people in home versus long-term care. There's abundance of evidence to say that it is much less expensive to support people at home. And regardless of the cost, we do not have enough long-term care capacity when we look at the aging population. It doesn't matter how much money we invest in long-term care as an expensive solution or option. We are never going to have enough capacity given the aging population. So absolutely, keeping people safe at home is a top priority, to the point even, and I think the same could be said about hospitals. We're never going to have enough hospital capacity. One of the emerging, based on experiences in other countries, is really starting to look in Ontario at a model called hospital at home. So who are the people that are currently being cared for in the hospital with acute care needs that could safely and probably cost neutral, but just from a capacity perspective, it's much less expensive than building all of the long-term care homes and all of the hospital beds that we would otherwise need to support.
People want to be at home, generally speaking. Right? They
Yes.
want to be at their home. I know a few times I've been in for something, the first thing I want to do is get out of there,
Yeah.
get home and be in your comfort space. And it's nothing about indicative of the service or the hospital itself. It's just,
It's not.
you just get people. So I think once you do that, it could come back here, but as you know, the county is the administrator for social services and long-term care and all that good stuff. They may have a bigger bat when it comes to asking for creation of a program, so we can kind of go down that road when it's.
Yeah, I work
appropriate, but-
closely with the county on the health and housing work that we're doing, so I'll connect with them and.
Well, I haven't spoke to them, so I don't know how well it'll be received if you go and say, the mayor was
No, I won't.
saying this down in Whistler, they'll have no idea. So, but it can start here. It can start here and we can gently nudge it up if you prefer, or if you just rather take it to think that's fine too. I'll let you do that determination. I believe that's it for my notes. So I really appreciate, I have heard some grumblings about the long-term care in Morriston. It's very small. I don't know if they have the ability to expand. It'd be unfortunate if that were to, end up closing. I don't know if that's even the case. I'm not putting that in the community, but we'd very much like to be kept apprised of the situation there. If there's things we can do to support, I mean, we can't run it, we can't afford to fund it, but
I will make a specific request to the Ministry of Long-Term Care, asking if they can provide us with a line of sight on the capacity planning, the long-term care capacity planning efforts that they are making for Gulf Wellington generally, and including Post Lynch. And I'll let you know if I receive it.
there is interest in that area to build a long-term care, very high level. We had a meeting with provincial representatives. But it's primarily greenbelt there, and I believe the nursing home has a chunk of land. They're not using it all, but in order to develop long-term care near that one within the greenbelt required, what's the new? We'll use it for the airport. Special economic zone. So anyways, that's very challenging situation. So there is appetite in the community to build. It's the services and the location that seems to be, and the license. Anyways, I'll leave it there. Thank you again for a great presentation.
If any questions come out of this, I don't, I've probably created more questions than answers possibly, but I'm happy to gather any additional information before we discuss.
Excellent. Oh, Councillor Bailey might have one further.
No, I just wondered if we had her Amy's contact information. Okay, that's great. Thank you.
Can I get a mover second to receive that for information? Councillor Bailey, Councillor Hurst, in favor? It's carried. Great. Excuse, are you two folks here for the speed bump? Pardon me?
Anyways.
Mini Lakes, got you. Okay. So our next delegation is a written one, I believe. They're not attending in person, so can I get a second to receive that information? Councilor Hurst, Councilor Sepoulis, any questions or comments? No, Councilor Hurst?
Just in respect to the speed bumps, was there anything from staff that could respond to that? Not today, but in the future, just as to the circumstances of this written up in the delegation?
I believe they can, but I'll maybe park it quickly for Councilor Sepoulis. Do you know? That's good.
I just wanted to say in regard to that specific speed bump, I know, I mean, I can't speak exactly to it because I think the delegation came from the residents who live directly in front of it, which I'm not. But I can understand where they're coming from a little bit from a noise perspective. But that particular speed bump, it's like a strange, like optical illusion almost. There's a tree on either side that casts a shadow like exactly in that spot. And so I think when you're approaching it, it's almost like camouflaged at certain times of the day and people are like really slamming into it. And so I was speaking with our director of public works about possibly putting there is a sign, like a speed bump sign right at the bump, but possibly having signage a little bit before it and a little bit like coming from each direction to say like speed bump ahead. And it might just alleviate some of the noise and people hitting it too hard because they don't know it's there until the last moment. So just something to consider.
That's why I question of staff, we have a process in the road management plan where we do certain things. Can you just let us know rather with respect to this particular location, what the process was?
So through the chair, a roads management plan does have a registry of complaints that we've received, so staff track that as they come in. And so sometimes it's speed complaints or other things. And what we do through our budget process is we will compile that and provide council with a feedback and recommendations around speed mitigation. It can be for roads that are due for construction, which is the ideal time to add speed mitigation. But it can also be just if there's, rising concerns in the community about a specific section, if council wants to add mitigation measures through the budget process. So that's how this came about. So this section of road did receive several complaints. We also heard delegations from folks that were looking for speed mitigation. Again, really specific. This is added as a safety measure to slow down the traffic. So that's the process, and it's done annually and during the budget process, which is most appropriate.
Thank you.
You're welcome.
Councilor
Yeah, just my comments on this. Again, I was looking through the road management plan too, and I think putting a speed bump there followed sort of our general process. It also is following our general consensus of council to work with safety on the roads. It is a mitigation measure that we've budgeted for that, we've agreed works, and I don't know, have we had since this, my understanding is this has been in for 2 seasons now, or two years worth. One of the road mitigation measures is to do a temporary 3-year and then assess whether it's working or not. So to me, that kind of fits under this process for that. So I guess I'm just going to be looking for what sort of speed was or complaints was before and what's happening after, and that'll kind of give me a better idea of whether it's working or not.
I would assume we're still tracking complaints when they come in.
Mm-hmm.
If they're excellent. Is Mr. Fowler on the line? Just for the viewing public, just explain how the rationale worked for the placement of the speed bump, please.
Through the chair. So as the CAO indicated, we compiled data that we received for that stretch of road. It was pretty much an even split on residents having concerns from traffic tearing away from the stop sign at Arkle Road. just as well as we had concerns of traffic heading northbound coming into the village at a high rate of speed. It was determined that to appease both ends of that stretch of road, the speed humps were placed in the middle section of that stretch of road to try and slow down people coming from the stop sign and also heading north into the village.
I'm supportive of that methodology for placement. We've also heard that it's the large vehicles that are causing some of the nuisance noise. I do believe we've indicated Watson Road as a potential section for heavy truck management. I mean, maybe CAO could reach out to the inspector, the OPP, and just indicate that we've had residents' concerns about the heavy trucks operating on that piece of road and request additional enforcement. That'll hopefully mitigate some of that impact. And then as we roll out the heavy truck enforcement, if it's a successful program, that we look at Watson Road as a potential implementation. But I do recall we had quite a few delegations on speed concerns, and that was really the driving factor for the speed bumps. Okay, that's all I have. I'm digging more second for that. All in favor? It's carried. Do we want to move up Mini Lakes?
Sure.
For there next? Never mind. Justine's way ahead of me. What item number is it, Justine?
1.1.
I'll welcome you down to the table. Oh, good. You're a student.
I'm the engineer. Okay. So I'm not sure. I'm not sure what makes sense to go first, but I am the engineer that was asked to speak on Mini Lakes today.
Well, you're their representative or you're our representative?
I am the GEI, the company that I work for, works
Yes.
for the town.
Okay, so then
Yes.
you went first. Yeah, the engineer, sorry.
You're here first?
Yeah,
No problem.
I apologize.
Sorry for the confusion. It's okay. Maybe I'll answer some of these questions.
Very welcome, sorry about that.
Well, just to introduce myself quickly, my name is Courtney Pilkington. I am a senior water and wastewater engineer from GEI Consultants Canada. Our office is in Guelph. GEI has represented Mini Lakes as part of the agreement that we have with the town of Cushland for many years now. And this year I was the author for the report that reviewed the two reports that were written by the Aqua, who is the operator for Mini Lakes. If it's all right, I can get started.
Absolutely.
Just on the just a brief description of the water system that's in place there. So at Mini Lakes, there are 3 groundwater production wells, each with their own dedicated pump house and treatment system. The treatment system includes a primary disinfection using sodium hypochlorite, a multimedia filtration, and pressure retention tanks. All this is used to service 292 service connections in the area. There are 6 sampling stations, and the major works that was completed this year is 2 of the 3 wells were replaced in 2025. All sampling results and all testing results for those cleaning year were great. Water quality coming into the homes in this area is fantastic. I have no concerns at all. From this report, everything seems to be on standard. There was one question regarding the heterotrophic plate count from someone that I received. I'm not sure where that came from.
I would if I was a betting man.
Yeah. So there was one question regarding that, if there would be any concerns for that, because there were a couple of detections. So HPC is basically a microbial measurement of the different organisms that could be within different environmental systems such as water system. It's a naturally occurring environmental bacteria. It's all non-pathogenic organisms that would be concerned within there. And as part of that, the only concerns that we would have that is bacteria related would be E. coli and total coliform. These are both measured regularly as part of the Ontario drinking water standards, and the standard for that is non-detect. So we're not supposed to see any detection of any of those microorganisms. HPC is not part of that, so there's no health-based standard in Ontario for HPC. There's no maximum acceptable concentration. There's no concerns about having detection of some organisms occasionally within drinking water. This is something that naturally happens within a drinking water system occasionally. Personal experience is that an occasional result of less than 10 HPC means that the system is working totally fine. Yeah, the system that they had this year, I believe it was eight positive throughout the entire year sample. Most of those were 1. And the highest one, there was one singular event that had 6 count. And as I said, anything less than 10 is totally acceptable. And completely normal, and I would have no concerns about it. If a sample were to be higher or these were to happen more regularly, this could indicate that the disinfection needs to change a little bit, maybe increase the rate of disinfection further. But at this time, I don't think it's necessary. So as we indicated in the report, that is just to continue monitoring this to make sure that the health of the actual drinking water system is still good. Make sense?
Yeah. Perfect.
Any other questions about the water report before I move on to wastewater?
I'll give them that opportunity.
Sure.
You can just move on to the.
Okay. So the wastewater system has seen a bit more issues in the last couple of years, but Aqua has made some initiatives to improve that going forward. There's as wastewater is much more complex, there's a much larger treatment system that's on site for this. The treatment process includes a primary settling tank, dual rotating biologic contractors with alum injector. There's in different clarification steps, there's a nitrification tank with carbon dosing. And then within the last year, there was a portable treatment unit that was added as part of a tertiary treatment, I would say, to hopefully improve the treated wastewater effluent quality going forward. This system includes a inlet chamber, an aeration tank, a denitrification tank, post aeration tank, and a clarifier. I should also note that in 2025, there was one major equipment failure that happened in the system. The RBCs both did fail, and as a result, hauling the sewage offsite was required for a short time while that was being repaired. There has been some exceedances on record, not just in 2025, but for several years related to the effluents coming back for the CBOD, TSS, TP, and the nitrates. Kind of briefly explain what each of those mean is the BOD or CBOD is a measurement of the organics that is in water. The limit of this is 20 milligrams per liter. TSS is short for total suspended solids. There's also a ECA limit of this of 20 milligrams per liter. Total phosphorus is TP, and there's a compliance limit of 1 for this. And for the nitrate, that's nitrogen parameter, and the compliance limit for that is 8 milligrams per liter. So basically, historically, there's been several exceedances for these different parameters, which is why I think the initiative was taken to install an additional treatment unit to improve treatment. There is positive news that happened. So this was installed in June 2025. The majority of the sample results for the BOD, TSS, and total phosphorus were improved after the installation of this treatment unit. I consider this definitely a success, and this is what we want to see, is that the water quality has gotten better after this. And I am confident that with good maintenance and operation, that 2026 will also continue to have good effluent results with these as well. There's still some issues for the nitrate effluent. The process of nitrate is a bit more complex and it requires a bit more adjusting as we go along. Nitrogen comes into the system primarily through the form of ammonia, and then that has to be converted through a process called nitrification to nitrate, and then through denitrification to different gases that can be emitted will no longer be part of the system. So basically the treatment results are showing that there's some difficulties converting the ammonia, firstly, all of it over to nitrate. And then nitrate is what we actually measure, see that the system is with compliance. Ammonia is not measured as part of any compliance limits here, so that's not the concern. But we still do need to treat for ammonia anyways, as part of the system. There has been some issue for some of the samples converting all the way to the nitrous gases that would be discharging from the system. I'm not sure if Aqua, a representative from Aqua is on the line here. Okay. Yeah, so I would just, I guess my question for Aqua to be, what steps have they taken for the nitrates to ensure that they will be within compliance this year?
So Aqua will try to answer that.
You get the names of the representatives, should be Jose or Don. Jose would be best to see engineer.
Hello.
Welcome.
Can you hear me?
Yes, we can.
Yeah.
Yeah, I do apologize. So anyway, my name is Jose Casal. I am a senior engineer here with the Ontario Clean Water Agency. I actually been working with Mini Lake since 2017, trying to assist our operation team operating these facilities, the water and the sewage facility. I am actually being producing or being involved directly in the generation of these quarterlies and annual reports. So specifically in 2025, just to put a little bit of perspective, as it was said in the presentation earlier, there was a catastrophic failure on the 2 RBC units, which forced us just to bring an interim solution, which is this portable treatment unit. An environmental compliance approval was issued by the Ministry of Environment, and just to facilitate the operation and installation of this. So in reality, it's not working as a tertiary treatment pollution as it was said before. It's basically a sort of a substitute of what the system because in reality, the RBC system are no longer operational in there. So we use portion of this facility, which is the primary sedimentation tank, primary tank, and then we send it to the facility. So yes, there has been some improvement in the effluent quality over the last quarter of 2025. We're continue to work adjusting this temporary plan. I want to put something really in perspective here. The ultimate goal is just to upgrade this facility to a brand new MMBR facility. We are working towards that. We are almost close to complete the final design. We have already achieved, we've already received an environmental compliance approved by the Ministry of Environment. So we are getting closer to the moment to start construction onto this. And it's expected that something may happen this year, this phase. So in terms of the specific questions, what are we doing to try to keep this nitrification and denitrification process in check? Just the removal of the nitrates is becomes effective. As it was explained before, this is a very complex chemically process. It requires certain elements to take place. It requires, for instance, for the first portion of it requires a certain level of alkalinity. On the second portion of it, denitrification, it requires and a carbon source, and also requires its low level of oxygen just to for the heterotrophic and the type of microorganisms that take care of this portion to complete. So we are continuously trying to adjust the PTU based on the conditions that we have, based on the conditions of this plan. Again, this is not a full-blown plan. This is a temporary plan that we normally use as an emergency. So we're trying to continuously try to adjust to the system demands. And I believe that recently even we have done some sort of inspection, just trying to readjust or recalibrate this plan. So it's an ongoing operational effort to try to keep this in check. Again, I would like to everybody to keep in mind that this is not a full operational, full automated facility that will allow to maneuver this in a easier way. However, we're doing everything possible in our hands just to keep these parameters in check.
Thank you for clarifying that, Jose. I would like to add on to that. I recognize that the PTU is a replacement for the RBC. However, I did find it interesting that as much as the RBC had not done a catastrophic failure before 2025, that the actual water quality coming from the treatment system, when it included the RBC before the PTU, the system quality has improved overall better now that the PTU is in place. So this indicates to me that the type of treatment is better than what was working for the previous RBCs when they were installed. However, the installation of the new MABR system will be an improvement as well too that we can expect to see from Links in the future once that's approved. Yes, I did have another question that was related to the approval and the construction process for the new system. So is that able to be in design stage yet or no?
That's for Jose.
Jose, yeah.
Yeah, it's already in design. So just to put a little bit of perspective just for the council and the mayor, you cannot get an ECA if you don't have produced a design. So we already got an ECA from the Ministry of Environment that includes this new process in place. So design is pretty much complete. We are ultimating with the consulting engineers and records or working with them just to finalize it. And then the next stage will be the procurement of these construction services and then start construction. Again, that will take a little bit of time just to align all the dogs in a road and make sure that it is financially viable for the complex just to get started on this. But other than that, I think the design is pretty much at 90% or more, I would say. I'm not the person currently project managing this particular portion of the project.
Okay, thank you. And then the other thing that I wanted to highlight in here is that the subsurface disposal system, the tile bed, needs to be replaced. And there was discussion in this report about hopefully trying to do that in 2026, but they were trying to do that in 2025, but there were some obstacles at the provincial level as well too. So I guess has there been any updates on the tile bed system?
It is also in the books. Its design is pretty much complete as well. I think just to get a little bit more detailed information, I will contact my colleague, the one that is in charge of this portion, just to provide a little brief on this particular one. But my understanding is that it's almost at the same level of design completion as the newly upgraded wastewater treatment facility. There have been some challenges, there have been some obstacles, substantially one, because I mean, this is a different type of disposal because there's no any water body nearby, which is pretty much standard across the province. This one is subsurface, is on the ground, so it's a little bit more complex. But yes, we're pretty much in there. So I will circulate back to my colleagues. So if required, we will provide a little bit more update where we are on those projects.
I can add some information on that. We
Oh,
have-
please, ma'am. Oh,
Sorry.
please don't do that. Thank you. We'll get you down to the table when.
Yeah.
Okay, that's all for me right now. I'm able to take
Great.
any other questions you might have.
Okay, Counselor.
Yeah, thanks. Memories of grad school organic chemistry for me. Yeah, I thought the reports were very thorough and very descriptive, and I think, from my perspective, gave me a very clear understanding of the circumstances where they were, where you're at today, and also aspirations for the future. So I think I'm glad that you just noted. I think in your reports, it's like there's the good and then there's the concern, right? And
Yes.
in the goods, the water, well quality piece, and I think that's really good from a Mini Lakes perspective. And I think the sewage side, that's a journey. I think it's really encouraging to see progress. I would say from my standpoint, I think, yeah, a lot of my questions are more for the Mini Lakes crowd versus like a strictly an engineering standpoint. But I guess from my one question for you would be, just in terms of from an engineering perspective moving forward, are you comfortable with what has been proposed by the Clean Water Agency working with Mini Lakes, or are there any red flags that you have from your vantage point at this point in time?
Yes, so of course I have not seen the drawing or proposals or any other
Yeah.
further information than what was presented in the report for the system, but I am familiar with the treatment system that is proposed and it is good. It has been shown in other areas and I designed it myself in other places as well. So yes, theoretically, the treatment system will be effective at removing the parameters for the wastewater concern.
Oh, thanks. That's everything for me. Thank you.
Counselor Goyette?
Yeah, thank you. I don't necessarily have any technical questions. I mean, I think it's good to see that there's meaningful improvement in with the portable treatment unit.
Yep.
I guess my only question is, and maybe you don't know this, but given that it's an interim measure and it's a portable treatment unit, is I have no knowledge of how that works, but is that something that is reliable to carry through for the total duration of however long it takes this construction of the new unit to become online? Like, is there any concern that it's not capable of operating for extended periods of time?
Yeah, I would not have any concerns about that. I would say that this is, as Jose was saying, that this is a short-term system in the sense that it will be a couple of years and it is fine for even an extended period of time. It just means because it's portable, it would likely come in a storage container and then like basically shipped on site and placed in the right spot and connected into it. And then it can be taken off and moved elsewhere as necessary. These kind of setups are really useful in more rural areas like mining communities to treat their wastewater that's coming from there. So yes, this is good technology. It is good for as long as needed while we go through the design and construction phases for the more permanent long-term solution that will be designed in the future. Thanks.
I suppose.
Yeah, it looks to me like they turned the corner. It's the first positive report I've seen from them, and they echo those sentiments as well.
Yep,
That's great, and your report is very thorough, very easy to read.
thank you. Appreciate that. Yes, I'm very optimistic that it will continue to be good water quality coming out in the future.
Ms. Bailey?
Great, thank you. I guess my question is more around the temporary unit.
Mhm.
If I think back to when we were talking about trying to bring it to the location where it is now. I think we were trying to find it from Collingwood or something.
Okay.
Is there a risk that some other community is going to need a temporary unit and we're gonna be informed that, oh, it needs to be moved? Like, how do we handle that type of?
I would imagine that the company that this would have came from, I'm not sure where it would produce another one. There's not a limited supply of these around, like I've had to design these before and you can just buy them straight from customers if necessary.
Okay.
So I don't know exactly, I didn't know if this is like a secondhand unit or it's elsewhere before, but I would not expect that there would be concern that they're going to take away the unit before, while it's still necessary to do, because they're not gonna leave you empty-handed, exactly, needing to haul offsite.
Yeah, just because the numbers right now are looking good, so it'd be nice to stay on that track. Thanks.
Okay. I have a question I believe it's for Jose, so it's no disrespect, just because he spoke to the leaving. So Jose, are you there?
I'm here, yes.
Yeah, you mentioned the weeping tile, weeping bed, and that it's subsurface. I thought you mentioned that something about surface discharge. If there were to be a body of water in near proximity to this weeping bed, would that change the design of that bed, and or would that be a concern?
All right, let me see how to I can frame this properly, Rona, so we get an understanding. The subsurface disposal system is a very well accepted, well known, and used within the province of Ontario and Canada for the disposal of the final effluent once treated. It's common to find it out. It's normally used when there is no inadequate water body in the vicinity that this treated effluent can be disposed. In the hypothetical scenario, that would be a water body that could accept the effluent with the quality, subject to an assimilated capacity study and other studies that are required by the regulations and the Ministry of Environment. That could be a possibility. It's the most common use across Ontario and Canada, the disposal of the treated effluent on those water bodies. However, that is not the case for Mini Lakes. There is no water body nearby adequate to receive this treated sewage effluent. So that's why
my question was more based on contamination of a water body, not the usage of a water body for discharge. So if a water body were to be there, would the septic tile bed have a different design characteristic because of the possibility of discharge water seeping into said water body?
It wouldn't be a tile bed or a subsurface disposal system if there is a possibility to discharge into the water body. It's either or. There's no two of that. The impact on using this tile bed is on the groundwater. Therefore, there are like 9 monitoring wells around the property that continuously monitor.
Okay, I'll repose my question. Is there a minimum distance separation from a subsurface disposal system to a body of water?
Not that I'm aware of, based on the guidelines. I will have to check, but being honest with you, Your Honor, I am a little bit confused by the question. It's either one system or the other. It's not the two things. The subsurface impact the groundwater, the discharge into a regular outlet to a water body, which impact the surface water. So they are two different things. So that's why probably I'm confused about the question.
I recognize, I understand why there's confusion, but where I'm trying to go at is if Mini Lakes is rebuilding their tile bed, I would hate for them to be in a situation where something were to transpire that would then make that brand new tile bed not the right design for a new situation.
I understand.
My question is, is there a setback from a subsurface weeping bed to a body of water? Because if there's potential for that water to seep through the ground into a lake, and it's not being used as a discharge, as a river, as a typical municipal wastewater treatment plant would discharge into a river. What I'm talking about is the design of that sleeping bed. Is there any components of it that would change if there were a lake beside it? That's what I'm asking.
Can I answer
Yes,
this
you
question? Yes, so sorry, not to cut in, but I first did want to clarify here that what we're talking about is a subsurface disposal bed. So, this is not being discharged to a field on top around. Is it being discharged below ground? So you will not see it being discharged because it's going.
Oh, I understand all that.
So
Yeah.
okay, I just want to make sure we're all on the same page
It's a
here.
subsurface.
There would be an offset, like an offset that is required for this circumstance. I do not know what that is right now. I would have to look up to see what the standard would be, but I can promise that there is a minimum distance that is required from discharging to the source of the ground compared to a body of water.
Yeah.
I'm not sure offhand what that
So
is.
just rounding a little bit more on that, even before these can be constructed, and this is some of the conversations that we're having with the Ministry of Environment at the moment, and I believe there has been an ECA approved. They're subject to a series of studies to be done. It's a guideline is called FA, if I remember properly. I can look and provide information later. It's the level of attenuation of any contaminant that goes into the groundwater that have to be a certain level of the provincial guidelines. So even before it's constructed, even before the design of this particular system is approved, there is a series of elements that needs to be proved to the Ministry of Environment that is not potential cross-contamination or any source of water. So that's the due diligence that we're doing on this.
I'm comfortable. I did search up the ECA approval for the temporary plant. I hate to see this turn into a permanent plant. I don't know how much it costs per month to rent it. Did you buy it? The solution is a new whip treatment plant, and my computer just locked, so I wasn't paying attention, but it says on the ECA approval decision that the approval, I'll just say here, this treatment system will be in operation until a permanent upgrade to the sewage works is planned and constructed. So this can't turn into a permanent solution. The numbers are better. Agree with your statement that, and Jose, you mentioned there was a caveat that if it's financially doable, that you have to find a way to do this. Unfortunately, it's going to cost some money, but I appreciate all the efforts. I remember reading reports stating the infiltration from the roads and the maintenance holes and things like that. I would assume that that's been mitigated significantly with the improvements you've done in the community, because that's water that doesn't need to be treated per se, right? It's infiltration water that's going into your system, putting strain on it, all that good stuff. So we do appreciate the efforts, but I don't want this to turn into another situation where we were told it's temporary and now it's a permanent solution. So continue to work towards that reconstruction. Look up that MDS, I'll call it, MDS and separation, please. And can you let Courtney know that? And also take into hold on, Jose, take into Jose, please stop interrupting. Please take into consideration if you need to do any soil sampling for rate of travel, hydrogeologic pressure, whether if there's a negative pressure created beyond the property line, if that will draw the effluent through the soil, all of those things. Look at it.
I can look up the standards and provide that for you. Again, I'm not the design engineer for the system, but yeah, I can certainly provide the information that requested here for your knowledge.
Thank you. Jose, you wanted to say something?
Your Worship, I do apologize. It was not intended to interrupt you. I just wanted to add a little note. The PTU that is currently in place is a proprietary of Aqua. It's not a rental or anything. It's something that Aqua is doing as part of the operational contract just to help to address this on a temporary basis until the new facility is fully built and operational. That's the only thing that I wanted to add.
No, that's great, but I would stick to my statement. I don't feel that that's the permanent solution. So, needs to be the reconstruction, but I'm happy that it's performing better. So that's good. We're going in the right direction. It's excellent. It's been a long journey. We're all on it together. Okay, can I get a boomer second to receive that for information? Great.
Oh, I got a motion of staff. Right, both to staff, I recommend that these report be provided to Mini Lakes and thank Mini Lakes for their continued diligence in this project forward.
That's moved by Councilor Lewis. Can I get a seconder, please? Councilor Hurst. Questions or comments? And to receive the report as information. Do I guess that was right. Okay, good. All fair? Carried. Thank you very much.
Thank you.
I encourage you to stay, just in case something comes up.
Stay for, but also new ones.
Awesome. Now I'll invite you back into this here. Welcome back.
So if we would like to just add to, presentation that, that Jose had given, I actually have the design engineer's Gantt chart. And it,
Sorry, I'll just pause you. Just a brief introduction.
oh, I'm sorry. My name is Judy Dawson Keys. I'm the president of the board of directors for Mini Lakes.
I'm Leanne Clark and I'm the condominium manager.
We have the Gantt chart here from the design engineer, and it is showing that, as of June 22nd, the tile bed design will be at 90%. Also, just to add to, our tile beds are not a new tile bed. You had indicated in listening to your comments, it was like it was a new tile bed. We are rehabbing our existing.
Wow, okay,
Well, but
you're
not
getting
just-
me on.
not
new-
As far as- just
but
as
the
far
point
as-
is, you're gonna put in new
We're
tiles.
putting in new tile beds, but it's in the
Yeah.
same location where
Yeah,
they've
yeah,
been.
yeah.
We actually did look at another location on the property to put new tile beds, but it cost us less money. But the Ministry of Environment would not allow that because it was too close to a waterway and a neighboring property for discharge.
Yeah, and so I get, in the building world, if you have a shed,
Yeah.
you can rebuild the shed and it's not a new shed.
Yeah.
You could pretty much take your in, so I get the concept
Yeah.
there, but, I'll leave that alone. But
Yeah.
thank you.
With the temporary plant, it is a temporary plant. It is, as Jose said, it is owned by Aqua. We are putting in the whole system is gonna be brand new. The MABR water treatment system, new tile beds, so it will be a brand new system. The goal is to be up and running, in 2028, as Jose had mentioned. We're moving forward. We do meet with the design engineer. It was monthly. We've moved that up to every 3 weeks because things are starting to move along.
Is that all you wanted to, I'm not saying it wasn't enough, I'm just curious.
I would just like to answer any questions that you have,
Great.
or Jose or Dawn's on the line as well, who is the operations, in charge of operations of the plant too. So.
Yeah, just three things really quickly. Kudos, like I look back to a year ago and it was very different delegation that was given in terms of like just overcoming some of the challenges and where you're at. So I think this is forward progress, and probably I could only imagine not a lot of easy conversations internally within the Mini Lakes community. So I'm not fully aware of it, but I appreciate that a lot of tough conversations have had to been undertaken. My quick points were it's the cost model, and I guess from my perspective, these are incredibly expensive undertaking, or it's an incredibly expensive undertaking to do. And can you maybe just speak to the degree you can, the financial exposure for Mini Lakes to undergo this process, the ability of the residents within Mini Lakes that are part of the condo work to pay for all of this, and what your strategy is moving forward to undertake all this? Like, I think from the science standpoint, really good. And I'm glad that the degree that you're working with the engineers and the design folks. But could you speak to the cost side of this, if you will?
Yeah. We are working with, who's Brian?
Condo lending group.
Working with the condo lending group, and with the, engineers who do the study of the condo, the required study for our
Reserve fund study.
our reserve fund study. We do have a reserve fund for wastewater, for drinking water, and then the general reserve fund. Obviously, there's not enough money in the sewage reserve fund to fund something of this nature. We do currently have a borrowing bylaw, where we have used a portion of the money that we have. We used that for our road and drainage project last year. We are working with the condo lending group to do a second borrowing bylaw. And they have a repayment schedule that will be calculated into the ongoing increases in the monthly fees as opposed to a special assessment. There are two options that we could do. We could do a special assessment. We could do an increase to fees. The board of directors has decided to go with an ongoing increase in fees. It puts less of a strain on each individual homeowner all at once, and it's more manageable over a longer term.
That's good, and kudos for the management group there pursuing that to the degree you can. And I get sometimes this is confidential data, so if it is, then I'll respect that. Like how long is the repayment plan estimated to be? And can you give us a rough idea of like the quantity of the cost in aggregate?
Yeah, so the funding plan is currently the $6 million borrowing bylaw that we have in effect right now is currently at about a 15-year amortization. The 10 million that we're looking at proceeding with the next borrowing bylaw, we don't know the funding up. We don't know the terms of that yet. We have already worked that into the reserve fund study. We have kind of taken that total $6 million and 10 million kind of and merged it into one and have the funding already set forth for the next 3 years through the reserve fund study, and the notice of future funding has been provided to all the owners. So they're aware of what the anticipated cost increases will be for the next 3 years. So the community is aware of that. As far as terms of the second borrowing bylaw yet, that hasn't been established, but the amortization for the first one is about 15 years.
But I won't get any deeper than that. I think I appreciate that you've thought this through, and I think where I would be concerned would be is you have this wonderful kind of go forward plan in place, and where my head was going and reading the briefing notes the last couple of days, it's like, how do you get there type of thing from a financial standpoint? So it gives me comfort that you're thinking about this, you're communicating with the residents that all have a financial piece of this. So I'll stop there. I think, the only other thing I would ask would be, and I'm not sure how it is in terms of the reporting, but I think there are some pretty significant milestones that you're looking to achieve in calendar year 2026 in terms of the contracting work. In the realities with this type of work, it takes place when the ground isn't frozen, realistically, right? From this standpoint. So I would be curious if there was any opportunity or request from my perspective, and I'll leave it to maybe staff if this needs to get massaged or nuanced, but towards the end of calendar year 2026, when kind of like I'll call it the construction season is over, if you or the Clean Water Agency folks that you're working with could provide a status update, because I think what I've seen in the past is we get these annual updates, but I would be curious to just see a construction update towards the end of calendar year 2026. I mean, I'm not sure what our reporting requirements are, but I'll leave that for Courtney to maybe massage if she feels necessary. That's it for me.
That's good.
Yeah, thanks. Councilor Hurst has asked some really great questions. I don't really have anything to add to that. I would just like to say, it's very good to see that things are moving along, and it's very good to see that the investments are being made. So thank you for all your hard work on it.
Yeah, a question with respect to the weeping towel bed. When do you expect to start construction? Is it this year or next year?
No, it won't be this year, and and maybe our construction won't be this year. It will be tendered in March of next year. They are hoping to tender together the MABR, the actual wastewater treatment plant, and the tile bed reconstruction. We are hoping to get the same contractor. It helps with insurance issues, compliance issues, things like that, and working together. It's just easier to have one contractor looking after everything.
That's great, sounds good. I echo the other council's comments. Thank you very much for your due diligence and keeping on top of it.
Thank you.
Was it really?
Yeah, I have nothing else to add. It sounds like things are, like Councillor Hurst mentioned, you know, the conversation's much different than it was a few years ago, and it seems like there's a clear path now, and you're on track, so.
It's exciting to see you're getting to the finish line. I'm sure there's been some difficult decisions to make. You know, working off a knowledge that maybe is incorrect, but when new condo corps come on board, say in a city, and they make a residential development as a condo corp, my knowledge says that that condo corp has to be self-sufficient and their liabilities have to be funded entirely. So generally, anyway, so my question would be, I'm assuming that you would be working under the same premise that you have to show this liability of the septic system in its entirety and even the water system, and that incorporate that into your plan, your financing plan.
Yes, yeah, absolutely.
And that sounds like your plan now, you're showing 3-year increment increases. I'm not suggesting that gets you to fully funded, but you've already identified that you need X amount of money by X amount of time, and this is the responsibility of those landowners.
Yeah, so we were underneath the Condominium Act, that condo is mandated to do a reserve fund study every 3 years. Now that funding, every 3 years actually is funded over a 30-year period, believe it or not. Like the reserve fund funds it over a 30-year period, but we are required to do an update every 3 years. So the funding for the last reserve fund is actually funded over the next 30 years, but again, updates have to be provided every 3 years. Does that make sense?
You lost me a little bit. I think I'm getting it, but the point is, if they did one previously that didn't identify this major upgrade.
Yeah.
It is now in the plan.
Yes.
Which is
Yeah,
important.
absolutely. And I think that's where where Mini Lakes kind of fell into this, biggest problem was they were a residents association in 2015, where they didn't have to follow the Condominium Act and the rules and regulations. So they didn't have the proper funding in place, right? So now that we're a condominium, we have to follow those guidelines and have the proper funding to ensure the condominium corporation is adequately funded for the common elements that are there right now.
So you're living our lives.
Yes.
Because we have prescriptions where
Yeah.
thou shall fund an asset management plan,
Yeah.
for example. And then when we see rising construction costs and
Yeah.
we have to go to the taxpayer and essentially
Absolutely.
say we need to increase taxes and
They're in fact our taxpayers.
yes. So it brings, it's just important that that's in the plan. I think that's excellent. And also, this burden of the cost shouldn't be borne by, say, the next generation of people who live there. If you're living there, then you're get the use of it. So it's all good.
Yeah.
And again, I recognize it was probably very difficult decisions, and I support the incremental increases. To do a special levy, it can be significant money, and for some challenges for people to come up with that money. Whereas, again, you don't have to fully fund it in 3 years, but you have those incremental increases built in. That's good news. It's good for us from a municipality to know that this plant will be coming into compliance in the near future on a permanent basis versus the temporary. So yeah, it's good.
And I think if we go to the EAC approval, from my understanding, underneath the EAC approval, I believe it has stipulated in there that we have the use of the portable wastewater treatment plant until June of 2028.
Yes.
Yeah.
Just didn't want to turn into a permanent solution.
No, it definitely won't. We
Because
don't want it to be there.
that led into the, I'll call it your asset management plan, but now you're in the condo corp, you have to identify it.
Yep.
I mean, that already to me sounds as though you likely wouldn't be able to utilize that permanently
Yeah.
because you've identified it. So it's good. It's good planning. It's, well, again, a lot of hard work. So thank you very much for keeping us abreast of what's going on. And if you can provide some construction updates, that's great too. So Just move a second and receive that for information. Councilor Spillis, anything else? All in favor?
Thank you.
very much.
Thank you very much.
Thank you.
Consent agenda?
Here's for two receivers. Yes, 9 4.
9, sorry, 4-1.
Yes.
You didn't print my cheat sheet, let's see. This is on the other date. 9 4, was this, we don't need the.
Plain Road.
Oh, yeah. All right, Jeremy there, can you hear me? Welcome.
Sorry, hi, I was on mute. Good morning, everybody.
Good morning. Floor is yours.
All right. So good morning to the mayor, council, and staff. My name is Jeremy Train from MP3 Planning Solutions. We are the township planning consultant for the zoning bylaw amendment application at 7456 McLean Road West and 197 Brock Road South. The application was in front of council for a public information meeting back in November 2025. Since then, the applicant has worked with the township, the county, and various township consultants to address technical comments. We believe all of the technical comments for the zoning stage have been resolved at this point. From a planning perspective, I am of the opinion that the application is in the public interest, is consistent with the provincial planning statement, and conform with the County of Wellington official plan. For that reason, it is respectfully recommended that council would approve the zoning bylaw amendment applications as outlined in bylaw 2026-036. If council have any questions for the application or the recommended bylaw, I will be happy to answer them. Thank you.
Did we jump? Did he say the bylaw for something else? Was that right? Or is this still the claim? The number, I thought, I didn't see the number. Oh, there it is. Okay, just I'm sorry, Jeremy, I thought for a second there we jumped to. Okay, perfect, thank you very much. Councilor Hurst, anything?
No questions, thanks.
Councilor Gwynn?
No.
I had my questions answered with respect to some technical details. I'm good.
Okay, Councilor Phelan?
Questions?
All right, so is this 941 and 942?
I know it's just 941, which includes the two properties, so 7456 McLean Road West and 197 Brock Road South.
On the corner.
Yes, it's kind of like that corner of Brock and McLean. Yes, so it's just 941, and then it has included in the resolution to give 3 readings to bylaw 2026-036.
Great, can I get a move for that, please?
To clarify, so it's one property, it just happens to have 2 addresses.
It would be 2 separate properties.
Oh, 2 separate.
Yes.
Right, move for that, please. Councilor Hurst, Councilor Buss, all in favor? That's carried. Sorry, and then we're on to 942, that Jeremy's still. No, 943. 943, and that is who?
You just here.
Very like you.
This is the one.
I heard McLean Road, and I thought the site alt one is the one we were doing with Jeremy. That's fine. Hello.
Morning.
Morning, nice to see you.
You too.
The floor is yours.
Okay, good morning, council, and my name's Monica. I'm the Planning and Corporate Services Coordinator. And we are discussing the purpose of this report, which is to provide council with a recommendation to lift a holding provision on the property known as 4 Brock Road North. The purpose of the holding provision is to require certain conditions be met before development can occur and before the zoning is formally in place on the subject property. Holding provision 5 requires that a site plan application be approved and a site plan agreement be registered on title in order to lift the holding provision prior to development. Staff are seeking council's approval to proceed with the preparation of a preliminary development agreement with the property owner to address the outstanding site plan control requirements associated with the exterior works. And further, that council approves staff
to bring forward the necessary bylaw to lift the holding provision, subject to the owner entering into a preliminary development agreement in order to permit the interior development components of the project to proceed in advance of final site plan control approval and registration. Thank you. I'd be happy to answer any questions, and we also have MPG online for questions as well.
Great, so it's in your report, I think we were secondary for the recommendation, Councilor Goyette, Councilor Swartz, any questions for Monica or MPG, Councilor Hurst? Councilor Goyette? No? Okay, all in favor? It's carried,
Thank you.
good job. Consents?
Go.
What time are we recognizing the employee? Is that you? Right, on to consent agenda, so assume you want to read that recommendation, please.
So the consent agenda items listed for the May 27th, 2026 council meeting be received for information.
Your mover, please. Councilor Sparrow, Councilor Hurst. Any items to be removed? Councilor Hurst?
I had a couple, I think most of them got caught in the Q and A. I think the only addition I had was 6.8, which is the Township of Stone Mills FOIP opposition.
Councilor Goyette, anything? Councilor Hurst? Or Councilor Sparrow?
Yes, 1.5 town of Halton Hills, and then 6.10, Portsmouth Historical Society. 6.6, okay.
Instead of 6.5.
Councilor Bailey?
Oh, the numbers are different. Yes, 6.6,
I guess
I guess it's called now.
You want, did you, sorry, I apologize.
All the town of Halton Hills, there's two versions of this agenda. One has 6.5, and the other one has 6.6. I just, either one will work for me as long as it's tough.
We pulled it out. Yeah, I have it noted as 6.6, but it's,
Town of Halton Hills.
yes, the
Okay.
town hall.
Okay, sorry, Councilor.
And mine's the city of Richmond Hill one, which I have as 6.6, but it's. 6.7.
Yeah.
6.7.
Don't do it.
No, and well, now I don't know, just the Wellington County OPP Detachment Board report. 6.11.
Okay, so let's receive the last two. Let's receive the balance of them, all in favor? Right, 6.8, Councilor Hurst.
Yeah, it just very briefly, it was just the Township of Stone Mills, FOIP opposition. Seemed relatively straightforward. I think as a municipality, we need to ensure that there's transparency within the realm of the provincial government. So I felt that that would be something that could be widely supported, and we've accessed requests in the past to seek information for various reasons. So I see merit in it, and would just be communicating through our standard channels in support of that municipality's endeavors.
All right, so I'll get Councilor Hurst to move an endorsement of 6.8. Can I get a seconder? Councilor Goyette, any questions or comments on that?
Should we send a copy to our MPP?
Sure, you voted in favor of it. Okay, all in favor? It's carried. So that was it for you, Councilor Hurst, correct?
Correct.
6.8, or did you have 6.10 as well?
No, 6.10.
John did.
That was just, okay, so, Councilor Goyette, none, Councilor Spillis.
Okay, town of Halton Hills resolution request for review of provincial municipal fiscal framework. Staff have indicated they would that we should support this. It's basically a request for the province to provide more financial tools to help us with the continued downloading we have from the province, and to help with a stagnant ability to raise additional funds to pay for any new work we need to do. Rather than putting on the property taxpayer, we're looking at having a dialogue with the province to find additional funding tools.
We're gonna have a dialogue?
No, the Association of Municipalities Ontario and Federation of Canadian Municipalities.
So moved. So do you understand what he's asking? Just endorsement of this?
Yes.
So moved by Councilor Spillis.
Yep.
Councilor Goyette. Questions or comments? All in favor of that one? So that was 6.7 Town Hall Hills, whatever it was. Right.
Town of Halton Hills, yeah.
Okay, next.
Portsmouth Historical Society Archives, I'd like to, request to the, send a letter to thank them for their, continued work and, support, in their endeavors.
Right, moved by Council Lewis, seconded by Council Hurst. Any questions or comments on this?
Just maybe one, can that letter get forwarded to the Heritage Advisory Committee? I think that's an important angle for them. If staff could just do that.
All good? Okay, all in favor? It's carried. I think that's it for you, right?
Yes, it is.
And Councilor Bailey.
Okay, this is from Richmond Hill, just so we're clear. And I understand that the county is responsible for social services. That's kind of the gist of this this item. But what it focuses on is individuals with autism and other developmental disabilities experience a significant reduction in structured supports programming when they reach adulthood, including housing. It says there's an increasing need for innovative, sustainable, and inclusive models of care that support independence, dignity, and community integration. So what I was hoping is that we could sort of support this, but forward it on to the county with a request. I was wanting to request social services staff at the County of Wellington provide information on whether the county's positioned to explore integrated interdisciplinary approaches to care, including innovative models of housing and support adults with developmental disabilities, including the potential for an integrated living and participation model. So that's in this correspondence, including opportunities for partnership with services in the area. And not knowing what our delegation this morning was coming to speak about, but it's very similar to sort of what's happening there. And I just think any information that we can learn about and then be passing on to our residents is important.
All right, so moved by you. Can I get a second there? Councilor Lewis. Can I suggest that you just continue to work with the clerk of the CAO on the wording of what you asked social services? If it's too generic, they won't get the
I
answer.
think staff might have.
Could you prepare?
We have some contraction, yeah.
Do you want to read it?
Yes, so it's to receive for information, and whereas council supports the City of Richmond Hill correspondence related to integrated living and participation model for adults and developmental disabilities. The council directs staff to inquire with the County of Wellington Social Services staff to provide information on whether the county is positioned to explore integrated and interdisciplinary approaches to care, including innovative models of housing and support for adults with developmental disabilities, including the potential for an integrated living and participation model and opportunities for partnerships with services in the area, and that they provide a response back to Township Council.
Perfect. So moved.
Yeah.
Moved by Councilor Bailey. Any questions or comments? Councilor Hurst?
The only, well said. I can't disagree with any of that. I would just make note that we've got a world-class facility in Sunrise Therapeutic Riding Center that has young people and adults that both have physical and mental challenges that utilize that facility, and as this council has previously allocated funding towards a future residential component to that. So I think what Councillor Bailey spoke to, we're living it here. So I think I would just, if there's any opportunity, Courtney, to incorporate that, I think it would be well placed.
Right, all in favor? Carried. You have one more?
Yep, just the OPP detachment board report, and just in there, they mention their auxiliary had participated in the senior wellness fair at Mini Lakes. So I just wanted to draw attention to that and to thank the Mini Lake board. I think it was Beth, Barb, Judy, and Barb at Mini Lakes. I think it was quite a successful event. It was hosted, on private property. So I don't know if they got the participation that they might have got had it been hosted, say at the PCC or something like that. But I think it was a definite successful first event, and I hope that they continue to do that.
Okay, so move to see it for information. Suppose like for second deal. Questions, Councilor Hurst? No. Willie? Oh. Questions?
Nope.
All in favor? It's carried. All right, that gets through consents. 11:55.
John,
That's the 5:30.
I think so.
Yep.
Yep, see if who wears it next time.
Some of the shirt too, I.
Yeah. Just carry it back that way.
Yeah.
Come on in, gentlemen,
Man, yeah.
have a seat at the hot seat. Is this your first time at delegation table, John?
First time up here.
Yeah, that's what I mean, first time at this.
Oh, you laughed.
Yeah, maybe, maybe not. Maybe not. You never know.
Yeah, that's right.
Michael's familiar with this scenario, it's all good, so. Council, and we wanted to show our appreciation for your dedicated service to the township for, you probably know better the exact amount of years. I have started around January 1st, 1977.
Yeah.
Is that fairly accurate? As a volunteer firefighter next door.
Yeah.
And then you progressed into public works in the early 2000s, and we have 49 years. Is it a little light, or is that about right?
Oh.
Couldn't make it to 50, eh?
Yeah.
Just teasing. You're of a small class of people that serve a township for that amount of time, and I will say to you, I speak often with Mike, and he's never spoke a poor word of you. He's very impressed with your professionalism in the back working for the township, and I shouldn't put words in your mouth, Michael, but there may have been talk of cloning you because he's very happy with his group of individuals back there, and from myself and this council, I'll give them an opportunity to speak as well. I'd like to present you with a certificate in appreciation of your years of dedicated service. And thank you again. And I will say, I do remember you going to calls when I was a kid.
Yeah.
Rick and I going to fire calls, and it's interesting how things have transpired. So thank you again. We'll just open up the council to acknowledge your service.
49 years since I've been in this world.
Yeah. Me too. What about you, John?
I didn't mean it that way. Yeah, just a sincere thank you. I think, the reality for a lot of residents, the key touch points are, the roads and operation team, right? And that's what people notice. Yeah, having high caliber, long-term staff that take their job with pride and seriousness, and what more could you ask for? So congratulations.
Come on in, Chris. Councilor Grota?
Yeah, I just want to say thank you for all your hard work. Thank you for taking such good care of our roads. I know even my kids waiting for the school bus when you drive by and wave and, hey, Mr. Ferguson. We'll definitely miss that, but thank you for all your years of service. Have fun in your retirement.
I'll echo sentiments of the previous council. Thank you for all your years of service, and my wife will miss waving to you as well.
Okay, wave to you, eh?
Yeah.
Yeah, thank you. We haven't crossed paths a lot, but I do see you around in the trucks, and it's always nice to just, early on, it was like, oh, there's that guy. Like, there goes that guy. You're around a lot, but you've probably seen a lot of change in the last 50 years. We probably have a lot less gravel roads now. But thanks a lot for your work.
I'll turn it over to, I don't know who's appropriate to go first. You, Michael, or-
I guess I'll go finish it off, Johnny. Yeah, John Kerr, just an absolute remarkable individual. The amount of dedication and loyalty that he has provided this township is just phenomenal. He's the first one here. He's the last one to go. I know through my experience in the past 8 years of a leadership role that you were my first call, John. You were always there. There was never a hesitation. So I'd like to stand up and I'd like to thank you from all of Public Works. Thank you. I wish you happiness and I hope health and joy followed you in your retirement. And you're welcome back anytime.
John, if you want to say anything, that's really, no, thank you. We have this.
Not with me.
Yeah, that was the easy part. Yeah. And we have this plaque, we like your certificate, we'd like to present to you, and I don't know if you like a photo or not, but I'll bring you the, right?
Yeah, you need a photo.
There it is, all council has signed it, it's just recognition of your service, thank you very much. Thank you. Yeah, you want to do that, you may have. Yeah, you wanna go aside? Let's go aside for a photo. Yeah. Everyone. Where would you, well, yeah, it's your photo, where do you want? You want a grader in it, or you want a plant?
The truck in it.
Don't matter.
Yeah.
Going back.
Welcome back. Next item on our agenda is 9.21 Finance Report 2026-015, and I believe it's Daniel. Go ahead, Daniel.
Thank you. Pleasure to be here, council. Through you, Mayor Sealy. This is the annual final tax levy and rates report and bylaw, prepared to finalize the 2026 tax rates, as well as the final tax installment due dates of August 31st and October 30th of 2026. I'd be happy to answer any questions that council may have on the reports.
Perfect, thank you. I get a mover and a seconder for this report. Councilor Schools, Councilor Breda, any questions for Daniel? Councilor Hurst?
Just two very brief ones, and if you don't know this, Daniel, off the top of my head, that's perfectly fine, but I think it was good to see 947 people signed up for auto payments.
Great.
You know, up from the prior year. Do you have any point of reference, like what would 947 be of the total tax base? So like we talking 20%, 25?
That's a good question. I think it's, I would put it around 35%.
Okay.
And that's including the two plans that we have, the option one, which is the monthly installments, and the option two, which is the installments and the installment dates. We are working towards getting that number as high as possible, as it encourages residents to eliminate missed tax payments and no penalties on missed payments, whether that's mail or for any other reason. And to establish more communication between the residents as well, because when you use the form, you put in your phone number, email, it just creates more ways to get into touch with them, and yeah. So we are pushing that definitely, and the goal is to get it over 1,000 for next report, so.
Awesome, good progress. So yeah, I was just curious what that percentage represented, and I guess the other one is a follow-up to that would be, I know last year there was more effort to sign up for electronic notifications within the just tax notices and everything that goes along with that.
Yes.
Curious, again, not specifically a financial question, but just how that rollout went. I think it was well received from a lot of people that I heard from, I should say.
Agreed. Yes, yeah, we had a lot of just curiosity about that and interest in eliminating the mail kind of middleman to getting their tax information promptly. They actually get it before the mail's out, because as soon as we get it, we send it out. So if it takes like 2 weeks to get to a regular household, the e-billing people have like 2 weeks extra to kind of prepare for that payment if they didn't remember. So it is something that the forum gives us more communication with the residents as well. So it is something that we are liking as well in our department and are rolling out continually.
Great. I just think those are really positive things. So keep it up. That's it for me. Thanks.
I don't have any questions. Great report.
Likewise, no questions.
Thank you, sir. It's really?
No, and Councilor Hurst had my question, so thank you very much.
Thank you, councilors.
Ready?
Ready?
You should have heard what she just said. No, it's a simple question. I don't need a very lengthy explanation, but when you see the new and reactivated ones, I know there's a prescribed timeline to pay your taxes, and at the 2-year point, it gets more prescribed, and there's less options for people to repay. But that one column there says, back to 2024, it says 3 new and reactivated. So how is that transpiring if we're close to that 2-year period? Yet sounds like as they kind of all of a sudden met the threshold for not paying or something like that. So how do these almost historic ones kind of pop back up
And
it's
it's
on-
this with the tax arrears.
Yeah, yeah, tax arrears is on page 4 of your report, and it's under column 24, 25, and then 26. You had 18 files in 24, but then right underneath this is 3 new / reactivated. Does that mean, like, how do they get reactivated if they've kind of, I'm making an assumption they've made it to that 2-year point where it's like you pay or we move to tax sale, but so what transpires to get them reactivated or new?
Okay.
So too low of a question?
No, that's okay. I'm just looking, is it the table?
Yes.
23, 24, 26, or 24, 25, 26?
Yes.
Okay.
And then it says number of new reactivated tax arrear plans. I guess it's just the plans that are reactivated.
So,
Through the chair, we also have our deputy treasurer online. If anyone has any questions.
yeah, looking for the reactivated, there we go. So are you looking specifically for 2024, let's say?
Yeah, because it seems like that's a historic one, and how they all of a sudden reactivate, whereas I feel like I thought there was a prescribed process, and that kind of reads to me like, well, we reactivated some of these options that I was under the understanding were exhausted already.
For sure. So I think through the chair, that was information, that table, that part of the table is for strictly 2024. So then the portion underneath where it says 1 remaining, that's kind of just us reporting on how many of those 3 that were new and reactivated in 2024 are still open. So in 2026, those cases are all closed except for the 1 that is remaining open as of the date of writing this report. Sorry if that wasn't clear.
No, that's good. That's good. Thank you. That makes it more sense to me. Okay. Did I get a move in a second here for that? All right. Any further questions? Okay. All in favor? It's carried. Good job, Daniel. Thank you.
Thank you, Council.
Mayor. Or 922? This Miss Hassan? Oh, no, it's Michelle. All right. Floor is yours, Michelle.
Okay, thank you. Through the chair, the purpose of this report is to provide council a summary of the township finances for the first quarter of 2026. And I'd be happy to answer any of your questions.
So what's the recommendation for information? Can you move for that, please? Councilor Hurst, Councilor Bailey, any questions for Michelle?
I don't, there was good Q&A in the pre-read.
So I have my questions answered. I'm good.
Oh, I appreciate the first quarter report. Sorry, I skipped you. I have to kind of shift here. I appreciate the first quarter report because there were a couple budget lines that the councilors saw were, either relatively depleted, and that's the idea of these reports, gives us a good pulse on things early. So thank you for that, Michelle. Go ahead.
Michelle, I was just curious, I know this winter was pretty brutal in terms of the amount of snow and gas prices and salt shortages and all of those things. And I know we do have like a reserve, like a winter maintenance reserve, and I'm just curious if that continues to this next winter, is that what that reserve would be used toward? Or is it something that we need to look at if there is continuous high gas prices and lots of snow in the winter, that we need to create a new reserve?
Through the chair, I would have to take this back to the director to answer that for sure with the budget. I know that budget was increased for fuel in 2026, but for further clarification, I would take it to the director.
Awesome, perfectly fine.
Thanks.
Just fine. We can come back. I'll speak to that briefly. Yancey County is in a very similar situation. We've had at least 2 consecutive years of draw on the reserve. And then some reading in the paper, it seems to be a common experience for municipalities. I think depending on the size of the reserve, I don't believe Wellington County has proposed an increase from levy to, but that may be very much so, I think, is where your attention is going to. Again, so if we have 2-3 years of continued draw on that reserve, we have options, likely have to increase levy through the budget to offset that continued increase, but Mike can report back. So
Yeah, I like some years are gonna be, this past winter, there was so much snow, whereas the year before it wasn't, so it's gonna be up and down. And I think that's what that reserves for. But this year just got compounded, I think, with the fuel costs and the overtime and the salt shortage, all of those things just made it a more difficult year than others.
Absolutely. Okay, so, sorry, did I move or second? Okay, any other questions or comments? All in favor? It's carried. Okay, I believe we're on to 942. This is the one I goofed up on earlier. It's also on McLean Road. Monica. Good afternoon.
Hello.
I believe we saw you in the morning initially. We're on your report for the site alteration application, and the floor is yours.
Okay, thank you. Through you, Mr. Chair. The purpose of this report is to provide council with the recommendation to approve the site alteration permit application at the property known as 7504 McLean Road West. The purpose of the major site alteration application is to permit a total of 26,222 cubic meters of fill to be imported to the subject site for the purpose of redevelopment of the vacant site to a proposed transportation depot. There is only 2,222 cubic meters left to import for the project. The operational procedure plan and a mechanism to ensure that the impacted soil is not moved on site in the future are both going to be conditions of the site alteration agreement. And I would be happy to answer any questions you have about the report.
And the recommendations in the report, can I get a mover, please? Councilor Hurst, Mr. Bailey, right? Any questions or comments?
Yeah, just two very brief ones. So I understand from the report, it's just the latter 2,000 tons would be to finish off I'll say the elevation in preparation for the trucking terminal, I'm presuming. Was there, and I didn't see this in the report, was there any timeline associated with completing this project? My apologies if I missed that. I didn't see it in the briefing.
Yeah, so site alteration agreements, the permit is issued for a period of 1 year. They can request an extension of that. That is a delegated authority to our municipal clerk to approve those.
Thanks. Yeah, I think it's encouraging to see that this is coming to an end. So thanks.
I have a question, thank you.
Just a quick question. Have any idea on the start of construction facilities?
Sorry. Go ahead.
I was just through you, Mr. Chair. I don't have the answer to that question. I could take that back and get that.
For the end use you're talking about, right? Yeah, the trucking terminal. Staff could reach out to them because, yeah. Yes, Billy?
I did have a question in the Q&A. I was just gonna highlight it. My question was around, due to this project being retroactively managed. My question was around the fees that are paid and how we kind of recoup some of that if there's additional costs. And the response is that there is a provision in the bylaw where double permit fees are imposed, where the project is under enforcement, which was the situation with this. So that's good to know that we've got that in the bylaw.
Yep. All right, all in favor? That's carried. Are you 944 as well?
So.
Right.
Yeah.
Where's your again?
Through you, Mr. Chair, the purpose of this report is to provide council with the 2025 annual aggregate monitoring reports and the 2025 annual water monitoring report for White Wolf Property Management, Inc. This report will be brought back reiteratively as annual monitoring reports are received. Attached to the report are comments from the township's peer reviewers. For council's consideration, staff are seeking direction to send the peer reviewers' comments to the pit operator, MNR, and the Conservation Authority.
Okay, can I get a mover for that, please? Suppose, Councilor. Questions or comments? Councilors?
Yeah, two very brief ones. And I think this came up a lot in the Q&A, but it was with respect to the Roselle pit, just in terms of like non-action in terms of the water leveling. as a municipality, can we go back to the operator and just reiterate the actions that had been, or the recommendations that had been identified by our environmental for multiple years now, I guess. I'll leave it at that. I'm not sure there's much more we can do other than just kind of keep poking at it.
Sorry, Councilor Harris, wasn't there a recommendation from Stan to?
There was.
Yeah.
Correct.
Is that endorsed in the recommendation for the report?
I think that my understanding and reading it was just in my notes here that it had been flagged for multiple years with no action. So as a municipality, what can we do to action that, or at least request some action on Stan's recommendations? Others may have a different opinion.
Do you have a suggestion how we can action
So the draft resolution is to provide the township's peer review comments to MNR, as well as the applicable conservation authority and pit operator requesting a response. So we could highlight in a cover letter, we could kind of pull out those very specific recommendations and just highlight them, but generally we'd send the entire document.
When we send M&R, are we dealing with Crystal or who are we sending it to, General Inbox?
I'm not sure who we send it to specifically.
Yeah, through you, Mr. Chair, we generally are sending it to our general contact, but certainly we can be including Ms. LeBlanc as well, if that's desired.
Please. Sorry, let's have a comment on your comments on this. Sorry, I thought you wanted to comment on it.
All right, yeah, Council Hirsch, yeah, in the questions and answers, our consultant has said, I think sending a cover letter from Council of NMRF and MECP stating the following would be appropriate. So he's got two very wholesome paragraphs that I think we should be including in the letter. And my suggestion is that it also goes to the MECP, just simply because of the fact that they haven't raised the buffer or the buffer wall. As a result, the water is down lower and it's affecting the neighboring property ponds.
Yeah, that makes sense. Yeah, I think like I recall from Stan's report, there was 2 potential breaches there. So yeah, I'm good with all this.
We have a response from here. Anyways,
Yeah, just to build on both Councilor Hirsch and Councilor Scholas. Sorry if I don't think I read that in full, that Q&A, but I guess I was just curious. If typically when we send correspondence to the MNR and ask for a response, first of all, whether they do respond, do they normally respond?
Mr. Chair, it depends.
Okay, and if it makes sense to ask them to respond to like specific questions, and what I was thinking was that we ask them whether corrective action is being considered or required, and what the anticipated timeline of those things would be. And I don't know if it would be, instead of just sending the report and asking them to make just comments in general, like asking very specific questions. And I apologize, Councilor Scholas, if that's basically what you've already suggested.
Yes, it is. I think we should have staff draft up the request, and I'll send it to Crystal LaFrance at Winard. She responds generally almost every time. It does sometimes take some time.
Okay.
But I agree, though, if we just send a generic, here's a report, probably won't be we won't get the response we desire. But if we highlight the comments from Stan and I'm optimistic. So you mind draft that?
Okay. So Carl, the salient point here is it does not comply with the site plan. It's missing a meter of coverage.
And that's what we've been really talking to Crystal about, is site plan compliance of all housing. I recently sent one in concern around importation of fill, and she responded yesterday. Did you see that one? And it states that it's in compliance with the amended site plan from whatever year. Well, we don't have that site plan, so when I do a car report or a review of it, I wasn't working off the most current site plan, so obviously my response to her was, can you please send the most current site plan for us to compare where they put the fill? So anyways, I think we'll get a response from this if we kind of the way you're describing and go from there. Anything further, Councilor Wade?
Okay, are we going around for the other ones as well this time?
I don't know where everybody's talking about the Councilor, so just Councilor Bailey and then on the aggregate one, I think.
Yeah, I have nothing to add. I think the recommendation was to forward on the comments, and I like that we're making it a little more specific, so.
I have some comments too. I would like to forward this report, especially where it speaks to extraction ceased in 2004, so 22 years of inactivity. I would like to forward it to Tatmo, Brzezinski, and Mike Harris, Mr. MNR, with a little header. I'll back up. For Tatmo, it's for information just to highlight that we have legacy pits that are dormant for over 2 decades, because we speak to them about these pits and, you know, they haven't seen literally it transpired. So I want to just send it to town for the board's information. And then I remember the first meeting we had with the minister, Mike Harris Jr. He mentioned these legacy pits that go unused. I don't know if he's had a change of position, but I'd like to highlight that to him, focusing on the 22 odd years, and then Joseph, because he's our local rep.
I've got comments on St. Mary's McMillan pit as well.
Sorry, did I jump the gun? Which one were we talking about?
Roger was talking about McMillan's pit.
Sure, so anyways, yeah, go ahead.
Yeah, the concern I've got there is the report from the consultant for the proponent is very perfunctory. It's very basic, 2 pages type of thing. But what happened yesterday evening, I was called out by John McNee to the site where the fishery is there. And he said, have a whiff. Stood there, had a whiff. It was really, really bad after about 5 minutes. And came home and still had the smell in my nose. So John was saying this is happening earlier. Usually it happens in June and July. And it's quite obnoxious type of thing. I don't know how the people live there with that smell. But I could you were out there and you saw the one of the workers spooning dead fish into a crib type of thing. So my concern is this report that the consultant has done is basically dealing with the pit, but does not deal with the use current, which is a fishery. And I think we should highlight the fact that this is a fishery now. It's still under the auspices of the MNRF, and we should be getting a report dealing with the issues associated with the fishery.
This is McMillan Pit.
Yeah, the McMillan, St. Mary's McMillan pit.
What's the license number? Is it 5737?
Yeah.
Sorry, yeah, we were talking about Roselle and then I jumped over this, but that's fine.
Well, I thought McMillan that you started talking about.
I jumped. I said we're gonna stay on the first topic and we went to this. All right. It's all good. Okay. Comments, concerns?
Nothing in respect to Councillor comments.
I agree.
Really?
I agree. What was the direction though? We're wanting.
Asking the proponent to expand their comments or their studies on the impact that the fishery is having on the local environment.
Yeah.
And we can tie that together because the license, the reduced licensed area captures all the ancillary equipment to support the fishing. So I feel they may say, well, the pens are outside the licensed area, but all of everything that supports it is inside the licensed area, and that's how they're managing to keep it there. That's the same one that's got the 22 years in activity. That makes sense.
Well, yeah, because could that change the responsibility to a different ministry?
Well, if it's still licensed on the MRF,
But if it's a fisheries?
We'll find out, they'll let us know.
Yeah.
No, they'll just say, no, it's not somebody else, and we know who it was.
Yeah.
Well, then why then should they have all that equipment there for the fisheries if MNR is saying they don't have jurisdiction over it? They will open a pretty big, worms.
Yeah, yeah.
So, we'll figure it out, see what they say. Okay, and what is there the last one on there? Is that the two?
I have one more comments on the White Wolf.
White Wolf is the last.
Yeah, go ahead, Councilor.
Well, I just, my two very brief comments, I thought the recommendation in the Q&A was really good. I think the only other question I would recommend that we pose back to Hardin Environmental, like this is such a unique circumstance that happened with the White Wolf property. That how do we collectively take this monitoring and I don't know where the end point is on this one, but to take this monitoring, and maybe this is a better position with Stan, would be like, how do we learn from this? And how do we share this with other jurisdictions that are experiencing something similar in terms of the recharge after very significant water taking events? And again, for this municipality, I don't know, but I think more just like the knowledge and the greater good around the significant water taking activities. And I would ponder that or push that to Stan to ponder and possibly report back. That's it for me.
That's great.
Yeah, it's a great idea, and the recommendations in the Q&A are also very good.
Now the recommendation is Q&A, yep, share the multi, ask the Source Water Limited to share the multi-aquifer well study. And ask the Source Water they would undertake the lead to update the cumulative impact assessment.
Here.
Yeah.
Right, really?
Oh, I was gonna highlight those exact two recommendations. So it's great to see that in the report.
You wanna read what you've captured or?
We have a high level, it's a little
Sure.
work still, but to receive the report, the council directs staff to provide the township's peer review comments for each report to the MNR, the MECP, applicable conservation authority, pit operator for a response. The McMillan pit operator be requested to expand their reporting to include the impact of the fishery on the environment and surrounding area, including the water concerns. That staff prepare a letter to be forwarded to TAPMO, the Honorable Mike Harris Jr. and P. Brzezinski for information related to legacy pits that are dormant, in this case, for over 2 decades without extraction. And the council directs staff to provide the township's peer review comments for the 2025 annual water monitoring report for White Wolf Property Management Inc. to the property owner for response. And the council directs staff to request the Wellington Source Water Protection share the multi-aquifer well study with the White Wolf Property Management Incorporated. And that council directs staff to request the Wellington Source Water Protection lead the cumulative impact assessment.
Principles.
The 2 paragraphs that were mentioned by Stan, sending a letter to the with respect to Roselle Pit, sending a letter to the MNRF and the ECP.
Yeah.
There's 2 paragraphs in the Q&A that highlight succinctly what council sort of implemented.
I'll put this through.
Got it?
Yeah.
Okay, do I have a mover or second for that? Should I be asking her?
No, you're good. No, you're good. We're both in the same document, so either one of us can
Here.
answer.
Great, so we have a mover to second?
Yeah.
Good, okay, anything further before we? Okay. All in favor? That's carried, thank you. 9.5?
And this is all of. Oh.
Yeah.
Welcome,
Thank you.
we're on
Good
your
af-
report, sorry, go ahead.
Good afternoon, Council. Through the chair, this is the Building Department first quarter report for 2026, which provide Council with the update of activities in Building Department for that period. myself and our CBO, Andrew Hartford online here. Happy to answer any questions you may have.
All right, any questions, Councillor Hurst?
No.
Councillor Gordon?
No.
Close.
I'm good, thank you.
Councillor Bailey?
I have none. Thank you for coming.
All right.
So we have a recommendation. See that for information. And move, please. Councillor Hurst, Councillor Goida? Everybody, all in favor? That's carried. Public Works Department, we have none, right? And 971, it's heater.
Through you, Mr. Chair, this report is to provide council with an update, kind of a mid-pilot update for the seniors drop-in program, and as well to request approval to extend their program to a 2.5-hour period from 1 p.m. to 3:30 p.m. on Thursdays. Can you answer any questions?
So recommendations for you, can you move it, please? Spruce, Councillor Hurst. Questions, Councillor Hurst?
Just don't mess with euchre, I think was my word. I'm supporting the staff recommendation, thank you.
Yeah, I'm thrilled to see that this is being so well received and that it's an initiative that the public is using and wanting to expand, and thank you to staff for all the work that they do setting it up and taking it down. And my understanding is that even though they are using the larger hall most of the time right now, the recommendation is not to make it permanent, but that the frequency of them not being able to use that is not super common. Is that correct?
Yeah, through you, Mr. Chair, that is correct. So as much as the program is scheduled to be in the Alf Hills room, we are moving the program into the hall if and when it's available, which has been the majority of the time since the pilot program has commenced in November. There have been a few community events and township events that did require use of the hall. So those few occasions they were relocated to the Alf Hills room. But yes, that is the common practice. Welcome.
I want to crystallize that comment, the discussion, by having the recommendation going to be added onto it and be relocated to the Archie McRobbie Hall when it is not otherwise required for their scheduled rentals or township activities. You cited in the report, you indicated here. I think it's important that we endorse that as council.
You made that change? Everybody comfortable with that change? It's just good for the next iteration, or some people are looking at it in staff, whatever. Nope, all good.
Yeah, just a question. Love that the program's doing well and love that we're being able to support. Just curious how, you know, I don't know if it's through the committee or just through staff, but how are we collecting feedback about the program?
So the subcommittee is attending the majority of the events weekly, and they are pulling those folks that are attending. They're also trying to do some kind of outreach within the community as well for those folks who maybe are not attending. Is it based on the time of day, location, access, the activity that they're providing right now? So the subcommittee is collecting a lot of information, and they are reporting that back to the committee when we do have our regular meetings.
Right. Okay, good. I like to hear that there's that constant dialogue going on. Good, thank you.
Great job. I've been approached several times. Just, the euchre's going really well. Enjoy it. And that was the one feedback. I didn't know, an extra half hour or something. I mean, but yeah, for people to just walk up to you and just give that compliment, and the staff have made that happen, it's just very rewarding. So thank you for facilitating that. All right. Do I have any merchants? Okay, all in favor of that? Great. Over. It's done. And two. That's for information, right? I'm gonna move her to seconder to receive the OPA 131 notification for information. Councillor Spillis, Councillor Goida, all in favor? That's carried. All right, council reports. We had our town hall meeting, it went relatively well. Just in terms of reference modifications, just to make it easier to get quorum and if we don't fill a regional area, that we can add a member at large just to, you know, there's other elected officials that want to participate in TAMO, but if there's seats already taken, then can't include them, and then we end up with a vacancy. So this was a way to allow that, but we did cap it at 2 representatives per municipality. Yeah, AMO conference is upcoming. I don't know, anything else to tell them? That's when we had our presentation with this group already knows about that and what, how do you pronounce it? Melanchthon. The new carts are being rolled out for recycling. If you want a smaller cart, there's been a link provided. I believe Councillor Bailey has shared that on her personal Facebook at least. And my understanding is to get the slightly smaller cart, you have to go and register for the smaller cart. Otherwise, you'll just by default get the big one. And I've contacted DOS at Solid Waste Services. Residents that have an ARU or 2 units in their home and desire a second cart, they need to contact Waste Management and inform them that they do in fact have 2 units there, especially with the ARU program rolling out. Or they could just operate off the one large one. That's their prerogative. But if they don't indicate to Waste Management they have 2 units, they will not receive 2 new carts. I believe it's going to be 2-week collection. Something else.
Violations or somebody arson.
Why don't you speak to that?
Sorry, Mr. Mayor, on the conversation item, is that available on the website for residents, or like I'm trying to see what type of communication we have?
So sorry, it's up to Courtney.
So through the chair, we have been receiving some information updates from the county and passing them along to staff. I don't know if we have a dedicated webpage towards it, but we are prepared to answer questions and things like that when residents approach us based on the information that's being shared.
Okay, I think it's important that this be conveyed to the resident, because if I wasn't a council, I wouldn't know about this.
This is the deadline. Sorry to
Go ahead.
interrupt you. It also says the deadline to request those smaller carts is June the 12th, which is like relatively soon. So
2026.
Through the chair, if we can, maybe the best place would be through our social platforms, just so that it can be pushed out just in the short time period.
I would expect that the county do a better job with it. I haven't seen anything from the county. I subscribe to the website.
Maybe we
To be fair,
county.
it's not a county program. However, they could take the initiative to. Anyways, it's run by circular.
I agree with you, but somebody should be helping the transition.
through the chair, the county has been posting more circular material, so the township can be sure to share anything that the county does as well.
Briefly speak. So through the chair, we were aware of some advocacy around including zoning or planning act violations, in this case specifically zoning violations, into AMPS programs for municipalities to be able to issue fines. So right now, the legislation does not allow municipalities to issue fines. Right now, if you have a zoning violation on your property, it does require you to issue a Part 3, which is it's a summons to court. So it's not a very practical tool in terms of cost or effectiveness. Yes, so again, there's been some advocacy, so there is an ERO posting right now to be able to allow municipalities to pass bylaws through their AMPS program to be able to ticket. So essentially a Part 1 fine, a ticket for zoning violations. So this is I'd say this is a game changer in terms of enforcement. Again, we're starting to transition as many regulatory bylaws into AMPS as we can because of the efficiency of the program. And this is a big piece that we're excited about to see if that legislation is approved. But we will put that ERO on an upcoming agenda for council.
And you'll have some comments prepared already.
Yes, I I'm not sure what the closing date is. We just were made aware of it today, so I'm not sure when the comment period is, but we will make sure if we miss it, we'll submit. I think generally the township is support of transitioning as much as we can to this sort of dance tool.
June 25th.
Time. There's time.
If you Google it, you'll see, this was driven by Caledon and their illegal trucking terminals. So they promised me some announcements, but VRO hadn't been posted yet, so I had asked Aldo to let me know when an email came through yesterday or this morning, and I thought it's coded, but
What's the arrow number? Do you know?
I have it right here. 0260558. I haven't read the proposal. Pretty. Anyways, it's good news for us, I think. We have similar reading what challenges Calvin has. I don't feel that ours are at that level. Thank goodness, because it sounds like it's pretty ramping up. Yeah. So this is good for us too.
Just off the highway.
It's good that it's consistent too, at a provincial level. Yep.
So we're happy. Okay. Yeah, so I get another second to receive a wonderful mayor report. Mr. Bailey, Councillor Hurst, all in favor. Carried. Any council reports? Any events coming up that I'm forgetting about?
Is that announcements?
No, yeah, very nice.
I have two.
Yeah, I'll do it. It's probably nothing for council reports, bylaws, Ms. Protestant.
That the following bylaws be taken as read 3 times and finally passed out from council. Bylaw 2025-035 being a bylaw to provide for the levy and collection of property taxes for the 2026 taxation year. Bylaw 2026-036 being a bylaw to amend bylaw 023-18 being the zoning bylaw of the township of Whistler. And bylaw 2026-037 being a bylaw to authorize the entering into a site alteration agreement with HPC Real Estate One.
Mover, please. Councilor Gordon, thank you. Councilor Lewis, all in favor? It's carried. Announcements. Councilor Bailey.
I was just gonna announce, through Conservation Halton, they have their major fundraising event coming up June 11th. It's called the Blue Gala. Anyway, Jim Cuddy from Blue Rodeo is gonna be there. It's at Area 8, so you can go on the website Conservation Halton /blue, and there's tickets are on there. And then, sorry, I'm just gonna pull this up. I did just get news from Councillor Bomer. There's an event in the summer called Berries and Bears. Saturday, June 20th, and it's up at the Museum and Archives. So check that out. Bring your stuffy.
Great. Any other announcements? Perfect. Okay, I'm gonna excuse myself figuratively from, we're gonna do closed session first. We're gonna do, right, and then do the minutes.
I think what would be good is if you've made your declaration for that one item, and so we could do our first item, and then if you wanted to leave chambers as we move into minutes, did you want to do that?
Yes.
Okay.
So we're still gonna move into closed.
Yes. Yes, we have your declaration noted though.
Councilor Hurst, Councilor Bowden, all in favor? It's carried. Welcome back. I believe we're at any business arising from the closed session. Oh, we gotta move on to open, sorry. Can I get a mover second to move into open? Councilor Hurst, Councilor Bailey, all in favor? Just receive. What's the next one? I should.
It's just to receive.
I'm fine. Yeah. I didn't know where to receive them is. So go ahead, Councilor Lewis, all in favor? That's carried. Is that the last one? Any business arising from the closed session? Seeing none, any notice of motion? No new business. Yeah. Permitory bylaw.
That the following bylaw be taken as read 3 times and finally passed in open council. Bylaw 2026-038 being a bylaw to confirm the proceedings of the council of the corporation of the township of Whistler at its meeting held on the 27th day of May 2026.
Can mover please, Councilor Hurst, Councilor Goida, all in favor? That's carried. Adjourned, please.
That council hereby adjourns at 2:09 p.m.
Please, Counselor Hurst, Counselor Bailey, thank you. All in favor? It's carried. For the rest of your day, folks.